gone to the Philippines in Asia for medical missions every year for the past 7 years. People's Republic of the Philippines is basically a third world country. They were an American colony after the Spanish-American War for a period of about 80 years. The Philippines has its own government, but they struggle with providing care for their own people. I do primarily cleft lip and palate repair, but also whatever surgeries need to be done while we're there. Cleft lip is a birth defect where portions of the lip don't fuse together properly in the womb, and this leaves a cleft in the lip. It may extend up into the nose. That may involve one or both sides of the lip. It may extend into the palate in the roof of the mouth. The incidence of cleft lip and palate is much higher in Asia than it is in the United States. Not only do they have a lot more patients with cleft lip and palate, but they have a lot less providers and a lot less facilities and resources to take care of these children. One of the benefits of returning to the Philippines every year is that I get to see my patients back that I've operated on. Seeing the change in the lives of the patients, children who now are normal children in school, playing with their friends. Things happen on the missions that seem almost unbelievable coincidences, and I can highlight this with a story of a girl named Ina. She lives in the southern tip of a remote island in the Philippines called Palawan. She's 20 years old. She has profound facial deformities, not due to clefts actually, but to another birth defect. Her mother died of cancer. Her father left her. She was living with an uncle. Dropped out of school at age 14 because she just couldn't stand being teased anymore. Walks around constantly with a towel up in front of her face so that nobody can really see her face. She had been to 3 other medical missions before and been turned away because her facial deformities were too profound. The other surgeon that was supposed to be on her trip didn't show. We had too many patients. There was only me to take care of them. She was going to take 4 to 6 hours to operate on her. If I could even operate on her, and there was a question of whether our facility would have enough services that we'd actually be able to operate on this girl. Through serendipity, the other surgeon did show up. Nursing staff showed up. We suddenly had facilities and we had personnel to be able to do the case, and I went to the mission director and I asked him, can I take 6 hours and do this one patient? The mission director said yes. So we went in the operating room, made a profound difference in her appearance. When she went back to her hometown, they had a big party celebration for her. She enrolled back in school. The missionary keeps me up to date with emails and photographs of how she's progressing. Her life has turned around. It's been a blessing to me to know that a few hours out of my life can make such a difference in other people's lives.